How would you describe the chatter around air pollution? Well, I'd say it's cacophony. It's frustrating to say the least. Year after year, the same conversation around who's to be blamed, what could have been done right, and then we forget all about it. Well, the fact of the matter is that the problems associated with air pollution do not go away even if the visible air in front of us is presumably clean. In the sense that if you can't get the stench of air pollution, if you can't get the stink and don't see the smog, doesn't mean the problem associated with air pollution have vanished magically. That doesn't happen. The long-term impact of air pollution is very serious, and it impacts not just our lungs. The impact is way deeper. It affects way too many organs. It in fact has an impact on our fertility, on our heart health as well. Our eyes, for example, need protection, special care in these months of pollution. Smog affects our eyes in ways you can't even imagine. Remember, the first thing to get affected when you step out, when there is extreme pollution, is your eyes. They start to water. That's a response of your organ to in fact deal with the situation in which they feel they're going to get harmed. So what do you do to protect your eyes? Here's more. Our eyes, our window to the world, overwhelm and pollution levels soar. Polluted air is full of harmful particles like dust, smoke and chemicals. These tiny particles irritate the eyes, leading to redness and a constant urge to rub them. A 2021 AIMS Delhi study found a 30% rise in dry eye cases during peak pollution months. Data from the WHO suggests air pollution-related eye irritation affects millions annually in urban Asia.
When the air is polluted with a lot of these PM 2.5 particles, they go and touch on the tear film and the eyes. And if there is dryness, then the eyes start to have a burning sensation, some irritation, foreign body sensation. Sometimes even redness can come, and reflex watering from the eyes can happen.
Pollution lowers the natural defenses of your eyes.
Our eyes are protected by the eyelids, which we can see outside as the skin, and then by the tear film, which is a three-layered film which is covering the corneas of the eyes, whether it is in the form of severe dry eye or some kind of a scarring of the eyelid, or if some foreign object gets into the eye and this barrier breaks, then infections and irritations in the eye can happen.
Prolonged contact with polluted air may lead to more serious problems like corneal damage or even cataracts over time. Air pollution reduces tear film stability, increasing evaporation. Urban residents, especially those exposed to heavy traffic zones, report higher prevalence of dry eyes.
When you are within closed confined areas, overall, because of the conditioned and controlled environments like air conditioning or sometimes even air purifiers, there is a decreased humidity, and that causes dryness. Because of the higher pollution that is there in the atmosphere, because of the increased amount of dust that is there in the atmosphere, a lot of construction activity that is going on, all this is also irritating the eye surface.
So how does one protect the eyes?
Try to stay more indoors, particularly on very heavily polluted days. Use purifiers inside to reduce the amount of suspended particulate matter. Drink more water, remain hydrated. You can even wash your eyes or face once a day with clean, cool water. If you're somebody who's going to be in the open, riding maybe a two-wheeler, then you must wear some protective glasses so that there's no direct contact that the eye has with the dry and polluted environmental air.
Research after research indicates that air pollution is impacting your heart adversely. It's shooting up your blood pressure. It's leading to inflammation. And that perhaps is the reason why just so many people are developing heart disease. Yes, Smog. Well, it's that time of the year again. Your eyes will hurt if it isn't hurting already. You will be switching on air purifiers if you haven't already, and you'll not be able to breathe. Delhi, like many cities in the country, have started to see the air quality index dip, which means air pollution is worsening. However, if you think the Delhi's dirty air impacts just your lungs, think again. Studies have established that it is your heart that takes a beating.
All the PM particles less than 2.5 or 2.5 to 10, along with carbon monoxide, sulfur dioxide, nitrogen dioxide, are direct injurious to the inner lining of the blood vessels, causing injuries to the blood vessels. As a result, the blood clots sit on them, the fat particles sit on them, resulting in blockages, resulting in a thin cap blockage or a thick cap blockage. Younger patients will have a thin cap blockage or 30% blockage. Elderly patient will have a stable, thick cap blockage.
Doctors have said air pollution causes blockage of blood flow in arteries and veins that causes hypertension, increasing the risk of heart disease because harmful ultraviolet rays absorb vitamin D from the sun, and the lack of vitamin D increases the risk of heart disease. High levels of air pollution can cause blood clots in the heart and heart blockages. And there are long-term impacts.
There is stasis of blood, stagnation of blood. The clots can go to the brain, cause a brain stroke or a heart stroke or a kidney infarction. Any ejection fraction or heart functioning less than 35%, the risk of sudden cardiac death is as bad as an end-stage cancer disease. Because of high energetic drive, decreased nitric oxide levels, the blood vessels become thick, your requirement of blood pressure medicine goes up, your sugar levels go haywire. So these are all long-term effects of pollution which we have to circumvent in one way or the other.
Who are the most vulnerable then?
Who are the vulnerable population for pollution? Number one, it could be smokers. Even a non-smoker is smoking up to 50 cigarettes a day thanks to the pollution. Who are high blood pressure patients who are more prone. People with pre-existing heart disease are more prone for pollution. People with uncontrolled diabetes, people with uncontrolled obesity, your BMI is more than 23, you are more prone for pollution. Many children and pregnant ladies and even elderly ladies whose immunity is low are more vulnerable for pollution.
Here's what's advised.
Avoid going out if the AQI is high. Always, if you have to go out, use an N95 mask. Always help make sure that you're vaccinated against pneumococcal vaccine, a flu vaccine, depending upon your age category. If you are having features of heart failure, fluids needs to be restricted, salt needs to be restricted. There's weekly monitoring of urine output has to be followed. A weekly monitoring of your weight has to be followed. Weight should not be gained because then you're regaining excess water that time. You should know your 4 numbers well: pulse, blood pressure, fasting blood sugar, and walking distance, plus your saturation levels.
A lot of questions are now being asked on why younger people are developing cancer. It's a disease in which your cells degenerate, usually seen in the older population. But younger people are developing cancer now, and it's becoming very, very frequent. Air pollution has a deep link with the growing instances of cancer in India and outside. Here's more. Living in Delhi is equivalent to smoking 30 cigarettes a day. And what happens when you actually smoke 30 cigarettes a day? Cancer. That is exactly the fallout of blanket, a thick smoke laden with PM 2.5 and PM 10 that you and I are breathing. Pollution is quietly fueling a new wave of cancers.
Bad air means anything when we say AQI is 200, 300 or 400, which we see in our metro cities like Delhi. So there are so many carcinogens in that air. There are micro particles like PM 2.5, PM 10. They are such a small and microscopic particles that when we inhale bad air, so they go inside our lungs, and through our lung blood vessels, they go actually in our blood cells, blood streams. And these particulates, they cause direct DNA damage of the healthy cells.
Cancer has long been associated with lifestyle factors such as tobacco use, diet and genetics, a quieter, more insidious driver of India's rising cancer burden is pollution both outdoor and indoor.
If you are living in metro cities with bad air, your lifespan reduces by 7 to 8 years. Bad air, polluted cities, the lifespan is reducing by around 8 9 years because people are having so many lung problems, allergy conditions, cancer, which is reducing their lifespan. So one side we say we have very good hospitals, and another side we have a polluted environment where we are forced to live. So fresh air is non-negotiable. It is the need of healthy life.
A 2022 study by the World Health Organization says that air pollution is responsible for 29% of all lung cancer deaths globally.
Sometimes we use incense candles. Sometimes we use mosquito coils and various sprays for fragrance. So these all chemicals, when they circulate inside your house, they are very harmful. You are continuously exposed to those bad chemicals, and especially children, especially women who are involved in the household work and in the kitchens. We should use chimneys in our kitchen. We should have a proper ventilated house, and if we can opt, we should use good quality of air purifiers.